Right, I'm going to go ahead and get started. So, thank you all for joining us. This is the American Association Public Health Dentistry's advocacy webinar entitled The Voice of One Can Become the Voice of Many: How to Become an Oral Health Advocate. I'm your host and your presenter, Dr. Katie Rothas. I am the American Association of Public Health Dentistry's Council on Policy and Advocacy Chair. And I'm also the current dental director at Whitney Young Health, which is a community health center in Albany, New York. So thank you all for joining us, and let's get into it here. So yes, I'll get this one slide advanced here. All right, so just some housekeeping before we get into tonight's presentation. I don't have any disclosures to inform you all of. This evening session is being recorded and will be available on the APHD website for streaming about 24 to 48 hours after tonight's program. So if you have colleagues that didn't get to join us tonight, they can definitely come and review it at a later date. The system is recording your attendance, so a PhD staff will pull the data from the Zoom platform so that you can be awarded your CE credit for this evening. During the presentation, please feel free to place questions in the chat to be answered at the end. And during the Q&A, if we don't have a lot of questions in the chat, I'm also going to open it up. We're a small group tonight. Feel free to unmute yourself and ask any kind of questions verbally. So without further ado, let's get started on tonight's content. So before I feel like we can talk about how can one become an oral health advocate, we first kind of have to understand the definition or appreciate the different kinds of advocacy that can take place. So, what is advocacy exactly? It's a kind of sometimes a obscure construct. But what advocacy is, it's an action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. And that can take place at the chairside level, at an organizational level, at the community level, the state, or the federal level. So we're just going to go through a couple of examples of each of those before we talk about then how can we as ourselves be advocates. And hopefully by going through some of these examples, you'll get some kind of ideas for yourself on ways that you can serve as an advocate at these different levels. All right, so we're going to start with chairside. All right. So when we're thinking about chairside, these are, and we're thinking about chairside advocacy. These are the kinds of questions that we, might be asking ourselves. How can we create a safe space for the diverse population that we serve? Can we address specific barriers our patients face in achieving optimal oral health? And how can we empower and educate our patients and our colleagues? So some examples of those. One thing this is one of my friends, Dr. Robert McKernan. He is a private practice practitioner actually, but he did start out working in a federally qualified health center that specifically served HIV/AIDS patients. And so when he opened up, and he himself is an openly gay practicing dentist. So when he was able to open up his own practice, not only Big Gay Smiles, not only did he want to create a safe space for the LGBTQ2IA community, but he also wanted to, make use the revenue from his clinic in order to invest in HIV/AIDS service organizations in order to reinforce their commitment to service, advocacy, and community empowerment. So on an annual basis, 10% of his annual revenue goes towards supporting local organizations and national organizations that are mission aligned. And he finds that in his practice, a lot of patients, both as part of the LGBTQ community and not, they like the fact that it's a mission-driven clinic, and the patients kind of align with that mission as well. So that is a way that he's been able to really kind of, get people who are more service forward coming to his clinic. So that's one example of chairside advocacy, but they can also take on a very smaller basis as well, and more patient to patient facing as well. So some examples I've got here. Lots of patients don't speak English is not their first language. So if we create, posters in our offices or in our health departments or literature handouts that are in different languages, that's a form of chairside advocacy. Patients with special needs trying to create, addressing sensory sensitivities in different spaces can be considered chairside or patient level advocacy. Creating gender neutral bathrooms, trying to bring local partners with your health department or university or community health center to kind of help address social determinants of health like food living in a food desert. Certainly, a lot of our, educating our patients about and the people that we serve the importance about voting. Consider hosting, a voter registration event where you work, or just, talking about the importance to the people that you serve, the importance of getting out to vote, especially in those primary elections like we had in local and state votes that we had like we did yesterday. So there's some examples of some chair side advocacy. Then we move on to organizational. So when we talk about organizational, that could be, where you work at the organization and bringing about change in order to advocate for perhaps maybe better work conditions for you and your fellow employees, or again, for the people that you serve, if there's, something that's consistently a challenge or a barrier for the people that you serve, maybe advocating to your C-suite to make some changes to address those barriers. This can also apply for organized dentistry. So if you're involved in any, like APHD or other organizations that write policy and have position statements, this is an opportunity for you to, if you see that there's an absence of a policy that should be there, or maybe a stance is outdated and should be changed, these are things that you can advocate for as a member. Or things like the American Dental Association have delegates that go to the annual session every year to both propose and vote upon resolutions and policy statements. So those are different things that, we think about for organizational advocacy. Same thing too, any kind of accrediting bodies. So things like when we're talking about dentistry, CODA, changing standards with CODA to, address challenges for maintaining accreditation. That is another example of organizational advocacy. Something more specific here. So again, when we're thinking about organizational advocacy, how can we promote changes to policy that improve access and quality of care? How can we promote changes to policy that encourage interdisciplinary collaboration? How can we educate leaders about operational challenges and propose solutions? So again, just some different kinds of questions that we can kind of associate with organizational advocacy. On one part, like as I said, going with regards to changing of standards for CODA. So myself and some other colleagues are involved and have grants from the Teaching Health Center GME program. And so they were supporting community health centers to establish dental residency programs. And because we were like the first or second there's only been two cohorts of community health centers to be supported with these grants. There was somewhat of a learning curve with the grants being designed and realizing that the standards for the grant didn't quite align with CODIS standards. One of CODIS standards for a program to have an accredited GPR AGD program is that your facility has to be kind of reviewed by a accrediting like a safety and quality control entity. Similar, usually they name the Joint Commission as a common accreditation for safety and quality. But that was because CODA didn't historically have a lot of experience with health centers, so didn't really appreciate the fact that at health centers we're reviewed and have visitation from HRSA every 3 years and go through rigorous review of our quality standards, our safety standards. And so a group of people who were part of the THC GME program collaborated with the National Association of Community Health Centers, or NAC. Also, the American Academy of Pediatrics was really leading the charge on this as well, because most specifically, it was impacting a pediatric program from getting accredited. And then also the National Network for Oral Health Access. They all got together to not only write and propose a change to the accreditation standards, but then they had letters of support that were sent to CODA. And so they were in 2024, they were able to successfully change that standard to allow for the OSV visitation to qualify as an accrediting body for safety and quality, which was extremely instrumental in these programs that had these program development grants, because having to get Joint Commission certified in first and then go through the process of getting CODA accreditation, it was delaying the process by 2 to 3 years. So this was a huge monumental win and change to CODA standards through advocacy, through a collective coalition of these different organizations. Another example, this was the at the American Dental Association House of Delegates meeting back in 2023. This is myself along with numerous other colleagues across the country. We've got Irene Hilton and Wang Lei from California. We've got Elena from Oregon, I think North Dakota, and Wisconsin were also represented in this group. But somebody had brought a resolution to the House of Delegates to the American Dental Association that was talking about engaging community-based health centers. And originally, when this language that you see on the screen was written, it was very much written in a way that it was saying that, the ADA and like local components or state societies had to kind of like insert themselves into health centers to kind of help them figure things out and support their operations. And all of us read this and we're like, well, that's not, we are pretty robust in, quality improvement and evaluation of operations and things of that with doing PDSA cycles. So we're like, it was just not written in a way that sounded very collaborative. So the members of the California delegation actually rewrote 3 paragraphs worth of language, and then reached out to colleagues from delegations across the country to be like, hey, we think this language promotes more collaboration and coming together to the same table rather than one entity inserting itself on the other. And so we were then able to go back to our delegations and give them a heads up. Hey, California is going to propose this drastic change from the floor. But this is why we think that you should support this. And certainly in New York, it was very cool. I was the only public health dentist in a delegation of like 150 people. And they all turned to me. They're like, well, Katie, you're the expert on this. What do you think of this language? How do you think? And so I was able to, explain my reasoning about why I felt like this language was really effective and would promote better partnership between health centers and ADA, the ADA tripartite. And so it passed without any kind of debate from the floor or opposition. So it was a very cool opportunity for all of us public health dentists that came as delegates to get together and promote and enact really influential change at the ADA. So going on to community and our next layer. So when we think about community level advocacy, we're thinking about what kinds of barriers to care do members of our community experience, preventing them from achieving optimal oral health. Are there changes to community infrastructure or available resources that can be changed through policy changes? And is there perhaps a knowledge gap among community members that could be addressed through a media campaign to advocate and empower local people in our community? So some example. So for me personally, community level advocacy I got to be involved. Now I think going down a year and a half ago, back in like the fall of 2023 or summer of 2023, the Albany County Health Commissioner and a member of the Common Council here in the city of Albany were extremely motivated to finally, after 60 to 70 years of attempts, to get water fluoridation passed. They're like, I think we're at the right political climate, and we have a mayor that is an oral health champion. Like, let's get this done. And so we were able to get involved. Uh, I got involved as the oral health champion. The health commissioner happened to know the CEO of my health center, and our health center is like walking distance or a short 5-10 minute drive from City Hall in Albany. So it just was seemed like an appropriate fit to be kind of the face and the representative for oral health for all the closed sessions that we went to present to the Common Council. We had to give presentations to different subcommittees to get their support for this legislation. So it really came together. We were very fortunate. Many people in our Common Council that were voting on this were members of the school district in different school systems. And so they were seeing firsthand the negative impact that not having fluoride in the water was having on kids and their attendance and ability to focus in school. So, well, we had to go through several rounds of public hearings. We got some assistance from the Schuyler Institute, who's on this call, so shout out to them. They helped kind of keep track of where things were at with the legislative process, what kind of chatter was happening in the anti-fluoride networks, helped put language together and data together. Um, Collaboratively, we're all able to get a positive vote in 2024, and so now we're waiting for the infrastructure to be finished. But there's been continued articles in the newspaper saying, despite what's happening on the federal level and other states, like we're committed to putting fluoride in the water. So hopefully within the next month or two, barring any kind of other hiccups with getting that infrastructure put in place, we'll see fluoride hit the water. We've already heard information that's gone out to the public to give them a forewarning that this is coming. So very exciting community level advocacy at work here in Albany. Now let's move on to our state level advocacy. So when we're thinking about state level policy change and advocacy, we're thinking about what kind of state policies should be changed to improve access to healthcare services. Could the scope of practice for dental team members be enhanced to expand services and increase capacity in our health centers or in other practice modalities? And how could the state Medicaid program be improved to expand coverage or increase provider participation? These are kinds of things, again, when we're thinking about state level advocacy, the kinds of questions we can be asking ourselves to get involved in. So, example for here again, going back to my own personal experiences. Um, oh, wait, I put some. Actually, I think I have one other slide in here, but. One thing that happened here in the last legislative session here in Albany is that initially we were actually advocating for medical assistants, LPNs, dental assistants, and parents to be able to administer fluoride varnish. We found when we kind of looked at California and we're seeing they were having really great impact on being able to use telehealth to do your like 6-month-old to 1-year old visits via telehealth and sending fluoride varnish home and having parents put on fluoride varnish under supervision via telehealth. And so we were trying to get something like that. And then also our auxiliaries in the medical and dental practices, because here in New York, in the medical office, they can apply fluoride varnish up to age 6 or 7 and get reimbursed for it. So we're like, how can we expand additional team members to be able to do that so that workflows can move more efficiently and utilization is increased? And so while we weren't successful this past congressional session with getting parents to be approved to apply. We were able to get medical assistants, LPNs, and dental assistants. So that was a big win. Again, that was a partnership with the Schuyler Institute. They reached out to myself and a couple of other people around the state to kind of provide testimony to the State Board of Education and a couple of other health committees that they had to go through the state assembly and the Senate and kind of answer their questions. And it was a really cool experience. And a lot of times, when we're talking to lawmakers, they're not health they don't have healthcare background, but a lot of them and most of them have experience with kids or grandkids. So being able to kind of give examples and like, well, do you brush your kids' teeth at home? If you can manage to be able to put toothpaste and a toothbrush on a kid's mouth, and brush their teeth safely, you can apply fluoride varnish safely and kind of, talking about those things, and kind of giving that, being able to have people kind of connect it, and not be like weary of it, is really, can be really instrumental in getting kind of state level policy enacted. Some other examples, in the last couple of years, actually in Connecticut, most recently, when they were seeing other states, kind of removing fluoride from the water, and having, RFK and other people at the federal level really kind of going after fluoride. They're like, well, we want to protect it in our state. So lawmakers in Connecticut were able to get together and actually write a law that says, regardless of what happened, federal policy is enacted, we want to keep water fluoridation at zero point 0.7 parts per million, as our standard, here in our state. So that was extremely impactful. And it was really nice to see that get passed and kind of be the opposite attitude, as opposed to what we've seen in Florida and in Utah. And then also a couple years ago, back in 2022, Massachusetts, question two was regarding medical loss ratio. So that's related to, how dental insurance companies invest the money that they get from premiums. So this was kind of a commitment and putting into a state policy that said, I think upward about 83% of money generated from premiums had to then be reinvested into patient services. So, and specifically for dental services. So, that was a huge initiative that, had a large, media campaign. There were different dental associations from different states that contributed funding, to help, with that initiative. So they were able to be successful, because this actually came down to a vote of the public. It was on one of their voter registration, or not voter registration, one of their ballots, for an election in 2022. So it wasn't the lawmakers, it was the public that had to decide to say, yes, we want this. And so they were successful, in passing that, through their various, advocacy strategies, and promoting it and educating the public about it. Um, so those are some examples of our state level. So closing out our final tier of advocacy, at the federal level. So when we think federal, similar to state, but again, just on a grander scale. So we're thinking what federal policies should be changed to improve access to healthcare services? Are there federal programs that should be renewed or increased in funding? Thinking like teaching health center grant funding, Ryan White funding, funding for the National Health Service Corps, funding for like the SNAP program or food, um, uh, yeah, our SNAP benefits and things of that nature, other public services, expanding, different policies with the, Affordable Care Act, so that we can expand coverage for, healthcare. So those kinds of policies, and then other what federal laws could enhance or hinder, with the delivery of oral health services. So sometimes there are federal policies in place that, can allow for, like insurance companies to, be able to apply federal laws that then they can get around state level laws, especially with non-covered services, and say that, even though their health insurance plan isn't going to cover a service, if person is in their network, then they give caps to how much you can charge a patient for services. So those are kinds of different policies that can have a positive or negative impact, on the way that, our healthcare systems function at the ground level. Right. So how, now that we've kind of gone through different examples, of our different levels of advocacy, how can you yourself become an advocate for oral health policy? So first, by identifying a problem or barrier that's impacting optimal oral health, um, in addition to identifying a problem, we also want to identify, well, what level of impact do you want to have? Do you want to have that address that barrier or issue at a chairside level, an organizational level, community, state, or federal? So that's kind of the first step in determining what kind of initiative or of advocacy that you may want to get involved in, either designing yourself or finding organizations that are already prioritizing and working on these kinds of initiatives. Then again, if you're going to be organizing your own advocacy initiative, the next step after identifying a problem and identifying the level at which you want to make that impact, we then have to be able to recruit healthcare and community stakeholders. So, thinking about other health centers or maybe hospitals or primary care associations. Going back to the example with our fluoride initiative here in Albany, we were looking at we had emergency room doctors, we had pediatricians who were advocates for us and provided testimony and letters of support. We had the Nurses Association, we had teachers associations and other school districts who signed letters of support. I'm trying to think of other organizations that we had, but just different kind of community groups that had a stake in, advocating and ensuring equity for health in the community. So those are kind of different types of stakeholders you can kind of think of that may have similar missions or similar aims and improvement in your community or at the state level or federal level. So once we have kind of healthcare and community stakeholders on board, then we have to, and these are some examples, like I said. So with our fluoride, we had Albany Medical Center doctors and support. We had the Schuyler Center for Analysis and Advocacy. So we had an advocacy group that had similar alignment of goals and mission. They specifically focus on health policy for health of families and children. Healthy Capital District was a nonprofit in our area that helped. First of all, they had a partnership with our health center doing school-based oral health services. So they had a lot of data with their patients, but then they could also provide anecdotal stories of what they were seeing due to the fact that there was no fluoride in the water. So that was a huge benefit to have as a partner in this. So again, different nonprofits, healthcare entities, policy organizations. These are all different types of entities you can recruit to support an advocacy initiative that you want to initiate. And once we have those in place, some additional people or groups to consider would be organized health organizations. So those are like your primary care associations and policy partners. So examples of those, like I said, the National Association of Community Health Centers. You've got the American Dental Association, American Academy of Pediatric Dentistry, American Medical Association. Here in New York, we've got the Community Health Care Association of New York, or CHCANYs, the National Network for Oral Health Association, American Academy of Pediatrics, like I said, primary care associations, and then the American Network of Oral Health Coalitions, and many states also have state coalitions, and ANOC is a great place to start because they have links to all the states that have states or regions that have health coalitions, and then you can look on their websites to see, what are their kind of policy priorities and focuses to see if they would also be good partners for an advocacy initiative you're trying to get involved in. Or if you want to see an organization that already has an advocacy agenda that you want to see ways that you can support it and be a spokesperson for those organizations. Again, these are all great organizations to kind of look at to see what kind of policy that they're taking a look at. And trying to advocate for change. Once we have all those players in place, Then it's time to also recruit decision maker sponsors. So if this is talking more, if we're talking about trying to elicit change at our city council level, our state level, and our federal level. I also would say if we're looking to make a chair side impact or organizational impact, that's where you're, trying to find your C-suite members or board members to be kind of sponsors of the change that you want to see made. So these are just some examples that I have here. So these are some pictures. We've got our state level. Pat Fahey's his state level representative. She used to be assemblywoman. Now she's a senator for our state. Thinking too, organizational wise, if you're at a university, getting the dean of the dental school or other institutions that maybe there's other deans at other health programs at a university that could be great advocates for what you're aiming to change or sponsors of it. Again, C-suite members if we're at a health center or health department. And then we've got also, if we're at a federal level, looking at our state, our federal senators and representatives. So this is a picture here of Paul Tomko. He represents our area in New York at the federal level, and he's always been a huge oral health champion. He comes to visit our health center a lot, especially when we're talking about Medicaid and other federal policy regulations being discussed at CMS or just, other policies, health insurance policies and other things like that. He's always been part of the conversation. So that, depending on, what level of change you're trying to look for, you're going to want to kind of to take a look at people that represent your areas or are the chairs of health committees or insurance committees, again, depending on what kind of advocacy or change you're looking to impact. And then kind of look at, a lot of times these leaders, these public figures have websites. So kind of seeing like what kinds of priorities do they have or what kinds of charities do they support to see if you can find the right types of people that could be an advocate or a sponsor if you're trying to pass legislation or pass changes at an organizational level. Again, oftentimes bring people together that are mission driven and have the same goals and mission. That's how you kind of bring everybody together to the same table and the same team to get to enact an advocacy initiative. And then also we want to engage the public. Again, depending on what kind of change you want to have, whether it's at making a change in the organization you work at, a lot of if you're serving people, people, provide feedback, provide complaints, provide some kind, if there's some kind of suggestion box, the more people that, are saying the same message, the harder it is for people to not listen. Same thing goes for community level, state and federal level legislators and policy making. If they have enough constituents and voters bringing the same problem to them, it's hard not to ignore. So those are ways, engaging the public to do these kinds of calls to action, as well as just educating the public about a problem or issue and that they have, trying to empower them to get involved and like, you can make a difference. You can help us make this change. Um, so these are just some examples of, again, ways to engage the public. So I pulled some of these from campaigns for advocating for fluoride. I think this one was from the American Academy of Pediatrics put out this fluoride cavity fighter that can be utilized. They have it on their website, but people can also order them to to distribute to patients or to put in windows. This was dental care is essential care. This was a bus ad. I don't know where this was a bus ad, but again, those are kinds of public service announcements that people, I know I certainly, when I ride public transportation, I'm always kind of looking at those advertisements on the walls, and sometimes you learn some things. So that's a great way to kind of meet the people where they're at to give them this information. This is another Rethink Your Drink. This one was specifically for I think North Dakota. Again, talking about sugary drinks and versus tap water, and why we want to make healthier choices. So again, different ways to kind of engage the public. Also, again, if we're going to be trying to change things at a community level or at a state or federal level, if we're collaborating with an organization, a membership organization like an American Dental Association or the American Academy of Pediatrics, who have kind of government affairs departments, they oftentimes have these things called calls to action where they can blast their members to say, hey, we're looking for letters of support for if there's a piece of specific legislation that we want people to speak for or against. These organizations will create template letters that it's very easy for people to then just put in their information, put in their zip code. It will literally, the system finds who their representatives are at whatever level of advocacy you're looking at. And then in 5 minutes, a letter to a legislator has been sent. So these are different ways that, our colleagues can be engaged as members of the public or, content subject matter experts of the public, as well as just general public. These are some ideas of how to engage those groups, again, to rally behind a cause. And then just some reminders, because advocacy is a marathon, not a sprint. So, sometimes you have to celebrate small wins. Like for us in Albany, we were excited while we didn't get our entire bill passed with regards to who dentists could authorize or who medical professionals could authorize to apply fluoride varnish. I was like, at least we got several people, or several additional team members to be able to administer it. So, sometimes you just kind of have to, it's the long game and like making those small chinks in change over time. Small changes equal bigger changes. And also sometimes, again, especially when we're talking about advocacy at a political level, there's a lot of level of movement that a bill has to move through. It has to first be proposed, then it has to go to a committee. I should say, first it has to be written and it has to get a sponsor to introduce it. Then that once it's introduced, it goes to the corresponding committee. Committee's got to review it. They may come back with some changes or, concerns and want to, inquire with experts about, well, what do you think about this? Or I'm concerned about, this, the implications of this. Then once it comes out of committee, then it's got to be introduced on the floor. So if we're talking about state or federal, you're coming through two bodies usually. Like at the federal level, it's the easiest to compare because it's consistent. State levels, it varies, but the federal level, you've got the Senate and you got the House of Representatives. So they each have to go, have sponsors, introduce it, go to the right committees. Committees then have to move it out and then has to be put to a vote on the floor. And it has to pass both the Senate and the House within a congressional session. And if it doesn't get passed, to then go on to the president who can still veto it or sign it into law. If it doesn't make it through that whole cycle in both bodies of government within one congressional cycle, it then has to go and start at square one again at the next congressional cycle. So this can happen, sometimes we can get really far in moving things and then it doesn't get all the way. So then we have to start back and like, again, reestablish those relationships, reintroduce things. So it's very often, sometimes it's almost like chutes and ladders. I feel like sometimes you're like, move up the ladder, you're getting really, really close. And then all of a sudden something happens and you fall, you fall into a chute and you go back down to square one. So these are just things, to keep in mind. Can sometimes being involved in advocacy can be really draining and it can feel impossible. And feel like you're not making any progress or change. But again, we just have to sometimes celebrate those small victories. And then I always say this, you can't wait for an invitation to the table. I think sometimes in my experience in the public health space. We think that everybody else recognizes the expertise that we have. But oftentimes they don't, or like we're not always, the top of mind when people are looking for subject matter experts. So, I really, kind of encourage people to take that initiative to kind of just, evaluate what is happening. Again, whatever sphere you want to make an impact in, kind of paying attention to what's going on, and then seeing what other groups that might have common interests, what are they doing? What are they up to? And seeing how can you get involved and kind of establish your credibility as an expert. And sometimes, there's going to be some things for some organizations that you don't always align on everything. Maybe I'll say, the American Dental Association is a great example when comparing to AAPHD. Like we're all in agreement with things like fluoridation and fluoridation policy, but there's some differences of opinion when it comes to like things like dental therapy. So being able to be in those spaces and being at those tables to have a respectful and impactful, discussion, and being able to help in places where we align, and then recognizing where we have to partner with different groups when we're talking about different initiatives. So, or again, you kind of bring your expertise, establish credibility on an issue where there's commonality so that when there's something that comes up that is a bit more controversial, you can be there to be able to present your perspective or your knowledge, data, insight. And so you've already kind of established a rapport and respect in a group. And so that, you can, by going when there's a bit more, um, you know, less alignment, you might be able to have a more productive conversation, maybe even change some people's minds when you do that as well. So again, kind of just finding ways to get involved in those spaces, and not kind of certainly be intimidating to kind of come into these spaces where you may not be known or known well, who are you, what are your credentials, kind of a thing. I've certainly have experienced that, not necessarily excuse me, always as being a public health dentist, but certainly being an early career dentist. Sometimes people, well, what do you know about this? And no one realizes kind of the opportunities I've had to be involved in policy advocacy. Because most people, 2 or 3 years, 4 or 5 years out of dentistry haven't had the same level or diversity of experience that I've had. In addition to having a master's in public health with a focus in health policy. So again, just kind of, figuring out ways to get into those spaces, have those conversations, and establishing relationships and partnerships. And those are always something that you continue to grow and develop, and continue to revisit. So I think with that, I have come to the end. That was short and sweet, but I want to make sure we have enough time for discussion, especially since we're a smaller group tonight. But I hope that this provides some nuggets for thought, or some inspiration or some ideas of how to get involved in advocacy, whether you're the initiator or you're going to find some opportunities in your area to get involved in yourself. If you have any questions, you can always reach me at my email here, KER415 at nyu.edu.